Gentlemen, let's have a candid, respectful conversation about a topic that so many men quietly wonder about but rarely feel comfortable asking out loud. If you are an older man, perhaps over 50, 60, or even 70, and self-pleasure has been part of your life for years, you may have found yourself asking a few private questions. Is this still healthy at my age? Could it be affecting my hormones? Is it doing something to my prostate? Is it somehow at odds with feeling strong and vital as a man? If any of those questions have crossed your mind, I want you to know something right away. You are far from alone. And this is one of the most common yet least discussed wellness questions I hear from men in my practice. Most men are left navigating this topic with outdated myths, half-truths, and a fair amount of unnecessary embarrassment. But today, we are going to look at this honestly and calmly, because when you set aside the stigma and look at what modern research actually shows, the picture for men in this stage of life turns out to be far more reassuring, and in some ways genuinely encouraging than most of us were ever taught. Before we get into it, I would love to know where you are tuning in from today. Drop it in the comments. It always amazes me how far this community of men interested in honest health conversations reaches. And if you find this valuable, a like and a subscribe helps this kind of open, stigma-free content reach more men who need it. Now let us address the outdated belief head-on, the idea that self-pleasure becomes unhealthy past a certain age, that it saps your energy, throws off your hormones, or somehow diminishes you as a man. These are ideas many of us absorbed from locker room talk or unreliable corners of the internet. But the evidence tells a different story. For most men, done thoughtfully, this is a completely normal part of adult wellness at any age, and it can even be a supportive, low-risk part of a broader self-care routine. That said, as with anything related to health, the key word is balance, approached with awareness and moderation. It appears to offer several potential benefits, approached compulsively or as a substitute for other parts of a healthy life. It can also come with downsides worth understanding. So today I want to walk through both sides fairly, a look at some of the potential benefits researchers have explored, and some of the risks worth keeping in mind so the habit stays a healthy and supportive part of your life rather than a problem. By the end, you should walk away with a clearer, more grounded understanding rather than fear or shame. For those of you who are new here, I am Dr. Narita, and for over a decade I have focused on helping men over 50 think through prostate health, intimacy, and confidence as they age. I cannot count how many men have sat across from me and quietly asked some version of, "Doctor, be honest with me, is this still okay at my age?" And my answer is always the same. You deserve a straightforward, evidence-based answer. Not fear and not shame. Broadly speaking, researchers have looked at two areas where mindful, moderate self-pleasure may offer some benefit to the aging male body and mind: physical factors that may relate to prostate health, circulation, and general function, and psychological factors that relate to stress, sleep, and mood. Let's walk through what the research and clinical experience suggest, keeping in mind that individual results vary, and this is not a substitute for personalized medical advice. The first area worth understanding relates to prostate wellness. Some population studies, including a well-known one out of Harvard, found an association between more frequent ejaculation and a somewhat lower reported risk of prostate cancer in the men studied. Researchers have proposed that regular release may help clear the prostate ducts of accumulated fluid and reduce the buildup of substances linked to irritation. It is worth noting that association is not the same as proof of cause and effect, and lifestyle, genetics, and many other factors play a role in prostate health. But the takeaway many clinicians share with patients is that this is not something to fear. It may simply be a normal part of how the body maintains itself. A second area relates to pelvic floor strength. The muscular contractions involved in climax engage the pelvic floor muscles, and over time, a stronger pelvic floor is associated with better bladder control and better overall pelvic function, which matters more as men age, and some notice more trouble with urinary control. Thinking of this as one small, incidental form of pelvic exercise can help take away some of the anxiety around the topic. A third area involves general tissue health. Regular arousal and erection increase blood flow to pelvic tissue, and healthy circulation is generally considered supportive of maintaining tissue elasticity and function over time. This is one reason many urologists encourage patients recovering from certain procedures to maintain some regular activity as part of rehabilitation, always under a doctor's specific guidance. A fourth area is stress regulation. Climax is associated with a rapid drop in cortisol, the body's primary stress hormone, and lower cortisol is generally linked to better blood pressure regulation and reduced inflammation over time. For many men, this translates into an easier time winding down mentally after a stressful day. A fifth area involves mood. The neurochemical release associated with climax includes dopamine and oxytocin, chemicals tied to reward and bonding. And many men report this contributes to an improved overall mood and a greater sense of calm and patience in daily life. A sixth area is sleep. The hormonal shift that follows climax, including a rise in prolactin and a drop in cortisol, is similar to the body's natural wind-down process before sleep, which is one reason some men find this genuinely helpful as part of an evening routine when insomnia is a struggle, always in the context of an otherwise healthy sleep routine. A seventh benefit worth mentioning is increased body awareness. Men who are more familiar with their own body through regular self-examination and touch are often quicker to notice unusual changes, a new lump, unusual firmness, or persistent discomfort. And catching these things early is one of the most protective habits a man can build. I have had patients catch early signs of testicular changes or other concerns simply because they knew their own baseline well. An eighth area involves general pelvic circulation, particularly relevant for men who sit for long hours at work. Better blood flow through the pelvic region is generally associated with less stagnation and better long-term tissue health. A ninth area relates to sexual confidence and control, for men who experience issues with premature ejaculation. Structured practice, using well-established clinical techniques like the pause and relax or gentle pressure method, ideally discussed first with a doctor or therapist, can help build awareness of arousal levels in a low-pressure setting, which can translate into greater confidence and control during partnered intimacy. And a 10th area is what some clinicians describe as maintaining desire over time. Regular activity is thought to help keep the neural pathways associated with arousal engaged, which may help preserve a sense of vitality and openness to intimacy even during periods without a partner. Now, as encouraging as these potential benefits are, it is just as important to talk honestly about the other side of the picture, because like most things related to health, moderation and awareness matter. And without those two things, a normal healthy habit can tip into something less helpful. The first risk worth naming is using this as your only coping mechanism. If it becomes the default response to every stressful, lonely, or difficult moment, it can start to crowd out other things that support real well-being, meaningful conversation with friends or family, physical activity, therapy, or simply sitting with a difficult feeling long enough to process it. The goal is for it to complement a full life, not replace the harder work of real connection. A second risk involves desensitization, relying on the exact same routine, pace, and pattern every time can. Over months and years, train the body to expect only that specific pattern of stimulation, which some men find makes it harder to stay responsive to a partner. Varying the routine and staying mindful of this tendency can help keep things balanced. A third risk is physical. Using excessive pressure, an aggressive grip, or very rough technique over a long period can occasionally lead to minor tissue irritation or, in some documented cases, contribute to reduced sensitivity over time. Gentleness and moderation go a long way here. A fourth risk involves frequency getting in the way of daily responsibilities, work, sleep schedule, or relationships. If it starts to feel less like a choice and more like something you cannot skip or control, that is worth discussing with a doctor or therapist rather than something to feel ashamed about. A fifth risk is emotional. Some men who grew up with a lot of shame around this topic find that instead of it being relaxing, it becomes tied to guilt afterward, which can quietly chip away at self-esteem over time. Working through that inherited shame, sometimes with a therapist, tends to matter more for long-term well-being than the habit itself. A sixth risk worth mentioning involves unrealistic expectations shaped by pornography. Frequent reliance on highly stimulating content can, for some men, Shift expectations about arousal and intimacy in ways that make real partnered connection feel less satisfying by comparison. Being mindful of this is worth it for both your mental health and your relationships. A seventh risk is neglecting an underlying medical issue. Using the habit purely as a stress reliever, without addressing what is actually causing chronic stress, anxiety, or sleep trouble, means treating a symptom rather than a cause. A good rule of thumb is to ask yourself honestly whether you are managing stress or avoiding dealing with it. An eighth risk relates to sleep timing for some men. While it helps many people wind down, for others doing it right before needing to be alert can have the opposite effect depending on individual physiology. Paying attention to your own patterns matters more than following a one-size-fits-all rule. A ninth risk, particularly relevant for men managing other health conditions like cardiovascular disease or those on certain medications, is not checking with a physician about whether frequency or exertion should be moderated. This is a conversation worth having openly with your doctor rather than guessing. And a tenth and final risk is isolation. If this becomes a substitute for pursuing new relationships, reconnecting with an existing partner, or simply building close friendships, it can end up reinforcing loneliness rather than relieving it. The honest, balanced conclusion here is that for most healthy adult men, this is a completely normal part of life at any age, one that current research suggests may offer some genuine benefits for prostate wellness, pelvic strength, stress regulation, mood, and sleep. When approached with the same mindfulness and moderation you would bring to diet, exercise, or any other part of your health. The goal is never to chase a specific number or turn this into another source of pressure, but simply to release the shame, understand your own body a little better, and know when something is genuinely supporting your well-being versus when it might be worth a conversation with a doctor or therapist. If you take one thing away from this, let it be this: you do not need to carry silent worry about a completely normal part of adult life, and if you ever have specific concerns about your prostate, hormones, or sexual health, the right next step is always a conversation with your own physician who knows your full medical history, not a video, a forum, or a locker room rumor. Thank you for spending this time with me today, and I will see you in the next one.